Team Care, NUR 610, Group QN-7, Meredith Rowland, Andrew Spears, Elizabeth Watts, Jennifer Wigington, and Christy Wysong. Team Care is a hospice organization that focuses on end-stage heart failure patients. We will provide comfort measures in the final days or weeks of life. We will serve patients whether in their own homes or in skilled nursing facilities. We will see them in urban and rural areas within a 50-mile radius of Birmingham, Alabama. We will focus on providing a patient and family-centered interdisciplinary approach. The team will consist of a palliative care physician, nurse practitioners, hospice nurses and case managers, nursing assistants, and pastoral care. A nursing team leader will lead weekly interdisciplinary collaboration meetings to ensure best practice methods. No decisions will be made without a collaboration session. Our microsystem will include clients and any employee of Team Care. The mesosystem will contain any person indirectly involved with Team Care's organization, such as pharmacy, medical supply companies, or the patient's family and friends. Our macro system will include the patient's primary care physician, cardiologist or referring physician, clinics, their hospital of choice, as well as private insurance and companies or Medicare. Patients with end-stage heart failure can include both male and females. It mostly affects older adults, approximately age 65 and older. We will see patients of all ethnicities and socioeconomic status. Our patients can be seen in urban or rural areas, but they will all be within 50 miles of Birmingham, Alabama. Qualifications for hospice are that the patient has received a terminal diagnosis with a life expectancy of 6 or less months to live. Patients must not seek treatment for their terminal condition. Patients must show a steady decline in health. If these requirements are met after the patients have lived 6 months, they may remain on hospice. If their health improves, patients may be discharged. Heart failure affects over 5 million Americans, with 10% being in the advanced stage. 400 to 700,000 new diagnoses are seen every year. The southern United States has the most deaths from heart failure than any other region. Heart failure can cause physical discomfort even during rest. It can cause cirrhosis or kidney failure, fatigue, nausea, lack of appetite, shortness of breath, and poor quality of life. Heart failure is estimated to cost $32 billion a year. Less than one-half of patients with heart failure will live after 5 years after receiving a diagnosis. Many elderly people misunderstand heart failure and the purpose of hospice or palliative care. This can lead to a delay in appropriate care and relief of symptoms. The unpredictable nature of heart failure can make decision-making difficult when choosing between vigorous treatment or relief measures. Team Care will consist of the following staff: 1 palliative care physician who will also serve as the medical director, 2 nurse practitioners, 10 staff nurses, 8 certified nursing assistants or CNAs, 3 team leaders, 2 case managers, and 2 chaplains. We expect the number of staff to increase as our number of enrollees increase. The advanced practice nurse plays a crucial role in the organization by determining whether clients meet criteria for hospice, completing admission documentation, as well as formulating a plan of care in collaboration with the physician. Team Care will primarily accept 4 forms of payment. These are Medicare, Medicaid, private insurance, and self-pay. Patients participating in self-pay must show ability to pay before enrolling in the program. The case manager will work closely with all of our patients to ensure that they are receiving the full benefits to which they are entitled. Team Care's budget is based on a per-day fee with a maximum of $156. Exclusions to the budget include treatments and medications aimed at curing the patient's terminal illness, care from a provider not initially approved, room and board, and emergency department treatment. The operational budget is currently based on 75 patients. The total operating budget includes all personnel and medical supplies. We estimate this to be approximately $1,700,000, as you see here. To create enough revenue, each nurse must see 4 to 6 patients a day and bill for each medical service provided. There will always be 2 nurses on call. This will create additional revenue by billing for after-hours services. We must bill for all services and ensure that payment is received, regardless of the source. Continuing education will make certain that best practices are used in the most affordable manner. Teamwork and a successful chain of command will allow services to be provided in an organized and timely fashion. Education about hospice in the community will help recruit patients and grow the business. Unlike most hospices, Team Care's personnel are experts in both hospice care and end-stage heart failure. Team Care will focus on current, innovative, and best practices with emphasis on patient-centered care. We will also provide respite care. This will ensure that family members are able to take a break from caring for their loved ones. Team Care will educate family members because family members will be our eyes and ears in between visits by our staff. We will work with the patient's primary physician to meet patients' wishes throughout their dying process. Unfortunately, the outcome for hospice patients will ultimately be death. Our goal is to improve comfort and quality of life. We will measure this by pain management, completing thorough admission assessments including the quantity and quality of pain. We will provide adequate pain relief within 48 hours of our first assessment, and we will provide after-hours follow-ups to new patients to ask about pain control. We will also work to manage other unpleasant symptoms such as difficulty breathing and swelling. We will aim to provide education to family members and caregivers through written materials about the patient's disease process and what to expect. We will give them satisfaction surveys to provide feedback about our services. Overall, revenue will measure our success. Team Care will provide nurses with electronic devices to document services at the point of care. This will allow for documentation for reimbursement, timely delivery of information to insurance companies, and first-hand access to evidence-based care. The National Hospice and Palliative Care Organization ensures that clients of hospice have a voice on Capitol Hill. 2 main bills this group is advocating for are the Hospice Evaluation and Legitimate Payment Act of 2013 and the Personalize Your Care Act of 2013. The Patient Protection and Affordable Care Act, or PPACA, refers little to hospice and palliative care specifically. It does allow, however, for accountable care organizations and bundling payments, which hospice services can utilize to provide high-quality but lower-cost medical care for patients on Medicare. PPACA also outlines quality measures, which hospice organizations must report to CMS as part of the Hospice Quality Reporting Program. This concludes our presentation, an overview of Team Care, an end-of-life approach. Thanks for watching.